thank you for inviting me today to present to you our new innovative cardiac compression. I'm coming from France, and I present my team, Dr. Yel and Professor Moreira. Well, let me resume very shortly the situation of pathological context of end-stage heart failure. You know, when the heart's going, especially for ischemic heart disease, you have, you know, the NV dilatation and volume overload, and together with the left ventricular contractile dysfunction. That is the two main characteristics of heart failure. So the problem now for years, despite advances in therapy, that we surgical therapy, interventional therapy, pharmacology, we still have more and more people, you know, affecting the heart disease. And especially in the case that you know that in the next few years, there's a lot of, you know, contributive factors like obesities, and you have more, we estimated that more than 1 to 2% of population, adult population in the world was affected by heart failure. So what are the current therapies for end-stage heart failure patients? The first thing is you have here heart transplantation. The heart transplantation is the standard therapy. However, there's discrepancies in heart transplantation around the world. In North America, which comprise, you know, you see that 7.5% of the world population, but accounted for more than 50% of transplantation, heart transplantation in the world. In Asia, it's very low. There is still a gap for heart transplantation, and we go thereafter. The second advances right now in the transplantation, the development of artificial heart failure that you can see here, some of them, and especially for the CARMAT, is a real artificial heart failure. However, it's still in, you know, in evaluation right now in 11 patients, but however, the outcome is very short then. And for the last few years, you can see here a tremendous development of left ventricular assist device, as you can see in the picture. And this is devices for, you know, apply more forces to drive here the circulation. And you can see in this picture there's a huge investment, economic involvement in that area because of the important progress in the past 50 years with innovative technique and technology for that. However, the limit of the current solution that you can see in this slide here in the heart transplantation, that you know that is very low number of availabilities of heart donors. And the problem with the left ventricular assist device here is because of the blood contacting medical devices of the patient. It's a very high risk of infection, a high risk of hemorrhage. So right now, this is a question about the possibility of external cardiac assistance. And what is external cardiac assist procedure here? You can see some of them already treated, already tried, but however, with very limited outcomes. You can see here the cock cap is a system that grab around the heart, the cock cap or the heart net is very, to reduce the volume. And you have here also the possibility in the 80 surgical technique, they call dynamic cardiomyoplasty. This is very complexity technical to grab around the heart with the dorsal, latissimus dorsal muscle. However, the outcome was really limited in the first year of evaluation. It's now completely abandoned. And the direct compression is not new. The concept is not new. The concept is how to create around the world, the heart here, a system that compress directly, mechanically, the heart, And as you can see here, the concept already described it in the 50s, 60s, with the first patent here by Arthur Winterberg, and the first scientific investigation by John and Anstad for here. With the initial aims, it was that to make an automated cardiac massage and to propose as a bridge to transplant. And here I can show you some of the development for the last years with a lot of patent, but right now completely abandoned too. You can see some system right here. So the problem with the direct compression is because of the technique problem. So you can see here in 1991, Lowe and his team have used a direct cardiac compression machine to maintain a failing heart here for 56 hours before transplantation. So it can be a system that's work. And very recently, an American team have developed it here for the big hearts, a system of compression, external compression by fluid type. And so you can see that they can restore the function of the heart when it's completely arrested. And so what is our system? Our system here that I can propose you, this is very innovative system that we can completely deploy it in the patient chest around his heart, and which can assist the movement of the organ. This is, our system is completely implantable. It means that all the elements of the device here, prosthesis, but also all the system of power supply and motorization will be completely implanted in the patient. And the prosthesis here exerts a cyclic compression on the heart by adapting the effort required for the organism. So we attempted to do it, and to do it we have to, answer for many questions. The first thing is how to replace the new, we call it the fingers or the palm around the heart. And you can see here the different position is not quite easy, because the heart, especially in the heart with ischemic infarction, there's a lot of area very facial, so we do not, to touch that region and to have all the fingers to work very well. So you have to position them correctly. So to do that, we have developed here a computerized modeling system to measure the impact on the cardiac work, the impact on the constraint, physical constraint, and on the impact also, and to make sure that we now able to put correctly and for the size of the finger, the positioning of the finger correctly. And secondly, when we started to validate it in a system, in ex vivo system, this is a heart completely, arrested. And this is a physiological pressure, normal, and this is the pressure that we obtained here for the left ventricular system and for the right one. Very close to the profile of left ventricular or right ventricular pressure compared to normal conditions. So it's a quite, advanced system. And so we have also tested with the electric current consumed by the motor. And what we have found is we have the possibility of estimating the energy required. It's about, here, approximately the energy available in a MacBook Pro battery. The problem that you can see in the heart, the problem with the system is require a lot of energy, and so this is a very good asset for us then. So right now we trying to validate it, the system completely implanted inside a PICS with the heart rate measurement, with the cardiac output measurement, and with the remote actuation completely in the abdomen and slaving of the system to the need of the heart. And the system were completely implantable and rechargeable energy sources by transcutaneous induction. So this is a project. I apologize for that because we don't have many pictures to show you because we have a patent right now, international patent, and so I could not show any of the details of our system. But right now we are very pleased to continue this project with its several preclinical tests, especially in the pigs. So thank you very much for listening. Thank you. And